dear friends. Welcome in Homeopathy Canada live session, and we are going through all the small remedy from Boric Materia Medica. So today we have one more important remedy, and that remedy is Rhus aromatica. So we have one colleague with me today. So start the discussion of Rhus aromatica. So I will share few cases of our stalwarts, Dr. Clark. He gave some cases, and I will discuss through repertory Rhus aromatica, where we can use this remedy, and through Materia Medica of Boric. So we are just waiting for her. She will join us soon. So Rhus aromatica. This remedy, if we see in Boric Materia Medica, Dr. Boric gave few indications of it. He says renal and urinary affections, especially diabetes. So in diabetes, when a person having trouble in renal or urinary tract problem, especially when the person is diabetic. Other thing, enosis due to the vesicle atony, and this is called involuntary urinations because of weak bladder, weak sphincters, and senile incontinency. When the person become old, they are not able to hold the urine and they get sick. And then hematuria, blood in the urine, and cystitis, inflammation of the bladder, comes within the range of this remedy. This information is given by Boric. And pale albuminous urine, incontinence, severe pain at the beginning or before the urinations. If you read sarsaparilla, they have a very similar pain, very similar pain, sarsaparilla. And if you read that sarsaparilla from uh, Allen's keynote, you will get the symptoms. You will get the symptoms. You will get the symptoms. I'm just waiting for her. One of my colleague will join. So sarsaparilla having a similar symptoms, very sharp pain before the urinations, but here severe pain at the beginning of or before urinations, before urination, and causing great agony in children's. Great agony in children. Children's having the similar, very painful conditions. And if you see in sarsaparilla, there is a very sharp pain before urinations. Before urinations. And this is because of small granules are there. So this is severe, almost unbearable pain at the conclusion of urinations. At the conclusion of urination. So at that time, it means the person is passing the urine. A very severe pain, very severe pain, and the same pain you will get in Rhus aromatica, especially in children's. Constant dribbling, constantly, involuntarily dribbling of the urine, and diabetes, large quantity of urine of low specific gravity. This information is given by Boric. And if you read Clark Materia Medica, you will get more information because Clark gave few cases cured with the Rhus aromatica. He says one person, 27-year-old, cadaverous, emaciated, haggard, had diabetes insipidus. Having a diabetes insipidus and Rhus aromatica teaspoonful doses teaspoonful doses of the powder root bark in a sweet milk 3 times a day, completely cured in 4 months. In 4 months, he was completely cured. He was completely cured. The person having diabetes, and emaciations. This is the key symptoms. Hope so. So thank you for joining. So we have a case. This is this case taken by Dr. Clark. Second case. If you read second case, a male of 37 year had diabetes mellitus. First notice increase of urine 10 months before and becoming so weak she had to abandon housework. She is not able to work, housework especially. Pain in the back, thirst, appetite, low, ravenous, now deficient, skin shallow, dotty. Temperature is 101, cough and night sweat, occasionally diarrhea at time. Specific gravity of urine is 1032 and Rhus aromatica half teaspoon dose every 4 hours and the quantity of the urine diminished next day, very next day. And as the diminished progress, the dose of Rhus aromatica were given at increasing interval, and in 3 months it was discontinued, proper diet having been observed in the meantimes. So we are discussing Rhus aromatica, where the person having a urinary complaint or kidney complaint with diabetes mellitus or diabetic patients. The third case, the case have the person having a incontinency of the urine more than a year, constant dribbling, slowly, drop by drop, the urine is passing continuously. Rhus aromatica 3 times a day, improve it once and cure completely in 8 weeks. Dribbling urine, constantly dribbling, not stopping because of the weakness of the vesicles. Fourth case, a girl had neurosis during day and night for 2 years. Bedwetting, day and night. Whenever she sleep, she pass the urine. Rhus aromatica, 1 part to glycerine, 3 part, a tablespoonful 3 times a day, fully cured the case. Fifth case, Boy early in summer had diarrhea, stool pale and thin, running from him like a water. No particular pain or fever. Diarrhea, they having no fever, no pain, and pale, emaciated, limb trembling, scarcely able to stand, and abdomen flabby. Rhus aromatica given in water after each stool cure very rapidly. Diarrhea when the person become emaciated. Emaciated. Sixth case, a laborer have chronic dysentery 2 months. On the average five stool a day, sometimes copious and painless, sometimes scanty with pain. Stool consistent largely of blood and mucus or clear blood. Patient thin, anxious, bowel flabby, abdomen flabby, and skin shallow. Rhus aromatica in 10 drops dose with boiled milk cured that patient completely. Completely cured this case. So this is given by Dr. Clark. So if we see in repertory, so we have a very few very important rubrics I have collected. So see, the first, involuntarily urinations. Bladder urination, that is involuntarily. Involuntarily. Day and night, daytime or night, both constantly passing the urine. We have few remedies here. So one of them is Rhus aromatica. Rhus aromatica. Day and night urination involuntarily. Second is urine involuntarily accompanied by sphincter weakness. So we have some remedies are here: apocyinum, belladonna, causticum, conium, ferrum phos, gelsemium, nux vomica, Rhus aromatica, and sebel cerulata, cecal core, and strychnia, where the urinations is involuntarily because of sphincter. The bladder and the urethra having one sphincter, and that sphincter allow the urine to pass out. So because of weakness of it, the urine is involuntarily going on. Next is diabetes insipidus with emaciation. Person having a diabetes, but along with it the person become emaciated, because before he is good in health, but after that the person having emaciation, the person become emaciated. Only single remedy is here: Rhus aromatica. Only single remedy. Then diabetes along with hypertension. Diabetes mellitus along with hypertensions, medorinum, Rhus aromatica, and the cecal core. These are the main remedies, proved remedies. Three remedies when diabetes accompanied by hypertensions. Hypertension. This is also one of the symptoms. Then diabetes mellitus with inflammation of urinary tract. Urinary tract, it means the person having a inflammations of bladder, inflammation of urethra, or this is because of prostate gland enlargement. So we have only three remedies here: Cantharis, Halonius, and Rhus aromatica. These three remedies cover these symptoms, diabetes mellitus, along with urinary tract inflammations of. And the last symptoms, Castle Wilson syndrome. This is also called diabetic nephropathy. This is called diabetic nephropathy, and this is the condition where Rhus aromatica is also cover this syndrome. This syndrome. So these are small remedies. These are very small remedies, and even in Boric Materia Medica, he give very small descriptions of it, but these are clinically proved remedies. They can, if we know the pathology, if we know how to identify the pathology, we can easily use this remedies along with advanced pathological cases. So it help us to understand. So this is a small portion when the person is diabetic and having these kind of urinary tract infections, urinary tract inflammation, urinary tract complaints. So hope so. This is a good learning of for all of us, and we can use these remedies in our daily routine practice. Thank you so much. Thank you, doctor.